Mrs. Mancini. My name is Carmen, and I'm a level 2 nursing student at McMaster University. And can I ask what your name and date of birth is? I'm just going to be checking that on your wristband to make sure that the information is right, just because we want to make sure that we have the right patient. So basically what's going to be happening today is we're going to be doing a catheter insertion, just because the doctors feel that this procedure is necessary because you have been voided in the past 8 hours, and a bladder scan was done and we found 630 milliliters of urine in your bladder. Alright, so now I'm going to be performing hand hygiene with hand sanitizer, just because my hands aren't visibly soiled. And I'm going to be positioning my client in a supine position with their knees flexed and their thighs relaxed. And I would also be putting a waterproof pad under their bottom, just because to protect the bed. Alright, so the first thing I'm going to do is put on my clean gloves. There's going to be a pair of sterile gloves inside the catheter tray, but as of now, this is what we're going to use. So we're just going to open up the catheter tray using the sterile technique. And so I'm just making sure I'm only touching the 1-inch border. And I'm just setting everything up onto. So we're gonna put the shiny side of the drape on the bottom. And we're just gonna lie this down in front of the patient. The next thing we're going to do is set up the garbage. And we're going to put everything we don't need in here. So the next thing we're going to do is put on the fenestrated drape onto our patient. And now we're going to open the catheter, and we can use our clean gloves to do this, just because there's another material on the inside, which is another plastic wrap. Oh, and now I'm just going to I'm just going to put on my sterile gloves. Okay, now that my sterile gloves are on, I'm going to open up the lubrication, and we're going to put that into the tray. And I'm going to open up the catheter and apply the lubrication onto it, and then leave it in the tray. And we're just going to lubricate 2 inches of the catheter. Next step we're going to do is we're going to open the antiseptic, and we're just going to pour that into our cotton balls over here. So now I'm going to grab the tweezers, and we're going to perform Peri Care on our patient. So we start off by getting the outside layer we're gonna get the other side, and then just down the middle. The proper procedure is that we're supposed to keep our tweezers on the side, like just right by the border of our paper, which was not done in the earlier videos, but this is how the tweezers are supposed to be set up. And just continuing on, now what I would do is to ask the patient to bear down as if they were about to void. I'm going to slowly insert the catheter through the urinary meatus until urine flows out of the catheter, and we're supposed to advance the catheter 1 to 2 inches after urine appears, and we're not supposed to force the catheter if it's facing resistance. Now that the catheter is inside, I'm going to release the labia, and I'm going to secure the catheter with my non-dominant hand. And I'm just going to inflate the balloon using the syringe now. I'm going to put 10 milliliters into the catheter. Right now we're using a 14F catheter, which is the normal size of a catheter for normal adult patients. And then now that the balloon has been inflated, I'm just going to tug along the catheter very gently to see if it's secure, and it is secure, which is good. What I'm going to be doing now is I'm going to be connecting the catheter drainage tubing to the actual catheter. Alright, and now I would assist the patient to a comfortable position, and since we've already attached everything, we can now dispose all of the equipment. So we're just gonna put everything back into the trash receptacles. And I'm just gonna also ask the patient to describe their level of comfort. And we're just also going to note and observe how much urine output that the patient is voiding. And if it's leaking from the catheter, or we see any excess fluid. Alright, so now that we're done, I'm going to be taking off my sterile gloves and just educating my patient as well. So I would tell them that it's normal to feel a burning sensation, because that normally happens after a catheter is inserted. Alright, so now the procedure that we're going to do is we're going to take out the catheter according to the doctor's orders. So I'm just going to do my hand hygiene, and then I'm going to put on my clean gloves. Alright, so now I'm just going to remove the catheter, and I'm just going to let the urine drain out. And then after the urine has been drained, we're going to use the syringe to remove the 10 milliliters that was originally inside the bulb. So we're gonna take out all of the water which is left inside the balloon, and then we're just gonna slowly pull it out. And now we're just going to clean up the rest of the field and put everything